Welcome to another exciting episode of wound care and going over different supplies that I use in both acute and chronic wounds. I'm really excited to talk about Aquacel and alginate dressing. These are kind of my mainstay dressings. We already talked about hydroferro blue, which is one of my favorites. Today we're going to talk about calcium alginate, which you see over here, as well as Aquacel AG. They're in a similar family. They're made of different components. The Aquacel AG is made of a hydrofiber that's manufactured with a cellulose product. I won't go into all the details. The calcium alginate dressing is made basically of brown seaweed. So it's not quite 100% organic, but it's made of a similar material. They're both great dressings for absorbing fluid and drainage, as well as anything that's kind of bloody. Now, it doesn't stop bleeding. I don't want to give any misconception or misinformation about stopping bleeding, but it does help with a bleeding wound. I would rather use this on a wound that has a little bit of a bloody serous drainage, meaning there's blood tinged with fluid coming out of the wound, as opposed to like a wet to dry, meaning taking gauze. Wet gauze doesn't really make sense on a draining wound because you're just adding moisture and it kind of sticks after it dries. These don't stick as much. They're great dressings. I use these primarily in acute wounds. Let's talk about, as we've talked about in previous episodes, about when should we not use this before we get into when we should use this. So I don't use this in wounds that have minimal drainage or very mild drainage. So that means I only use this in the acute setting, meaning wounds that are fairly new, between 1 to 3 months. Once you start getting to beyond the 3-month phase, I generally try not to use these unless there's absolute indication. They're used for absorbing drainage. They're great for packing wound. What I mean by packing wound is if you have a hole or cavity, and I'll show you a picture. You want to put this inside the wound. It's great. It's easy to use. I'm going to show you. I already had this pre-cut. And I'll show you another way of cutting this. My scissors need to be sharpened. I go through a lot of scissors. So we're cutting this, and you would pack this inside the wound to put it inside. You don't want to put things just on top if you have a hole. You want to put it inside because you want the inside to heal before the outside does. You can pack this, very easy to use. It's more forgiving than hydroferro blue. And don't get me wrong, I love hydroferro blue. I also like alginate Aquacel, but this is really great to use to pack a wound. Now, we had talked about in previous episodes, can it be used with Santal? So this is calcium alginate. This dressing can be used with Santal since there's no silver in it. If it came in a silver form, there's too much silver ion in it, which would inactivate or attenuate the effect of the Santal. Aquacel AG does not have a high dose of silver ion in it, so this can be used with Santal. I try not to use the alginate Aquacels with Santal. I prefer the foam dressings or other dressings to really use the Santal property or the collagenous to debride the tissue. I use these in any type of wound that has drainage, meaning I use it on pressure ulcers primarily, venous stasis ulcers or vascular ulcers, as well as traumatic wounds or post-surgical wounds. It's great for absorbing the drainage or the biofilm, as we talked about in previous episodes. The biofilm has bacterial load. That doesn't mean the wound is grossly infected. It just means every wound theoretically has some sort of bacterial contamination. We want to minimize that bacterial load or biofilm. If we can reduce the drainage and the amount of bacteria, we have a better shot at healing the wound. There are all these inflammatory factors that can hinder wound healing if there's a significant amount of inflammatory processes or bacteria. So we want to really address the drainage as well as trying to get it to close. Once this dressing or the alginate dressing is able to achieve that, we can switch to different dressings. So once we go from moderate to heavy to more mild, we can stop using the alginate Aquacel dressings. This is the dressing, both Aquacel AG, which is the silver form. This also comes in just without silver, as well as the alginate form. They both come in silver form. I use them primarily. I use the silver form if I'm worried about sort of increased infection or bacterial load. They are more expensive, the silver products, but there are times to use them. Meaning, if we're dealing with chronic wounds that do have a biofilm, we do want to use the silver over the calcium version. Both are great dressings in terms of Aquacel and alginate. They're part of my Bible or a Talmud of dressings with hydroferro blue, as well as other things we'll talk about in later sessions. I will show you different pictures of when I've used them. There's really no contraindication other than a lightly or mildly draining wound. I use them in the acute setting. I don't use them in the chronic setting, which means beyond 3 months, unless there's an absolute reason. I want you all to be comfortable with this. If you have any questions about Aquacel alginate dressings, please leave them below. Leave comments about future episodes that you'd like to, or topics that you'd like to talk about. I want to introduce myself as I've always done. I'm Alan Bienstock. I'm a board-certified plastic and reconstructive surgeon. My specialty is wound care in the homebound and bedbound. I primarily like to deal with chronic wounds that are very difficult to heal. I look forward to our next episode. Please make sure you subscribe to the channel when you get a chance and share with all your friends and colleagues so we can spread the word around. Thank you so much, and I look forward to our next episode. Bye-bye.